see and hear her passion in terms of the work that she does, and really appreciate, Karen, your call to action to the health centers to do something that can really make a difference in a woman's life, a mother's life, and their child, of course. So with that, we're actually going to turn it to another special guest we have, Dr. James Ryan. Dr. Ryan is the Associate Vice President of Women's Health Services at Union Community Health Center in the Bronx, New York. He has a particular passion also for improving healthcare to women in need and also to educate and improve their health. And so we're so excited, Dr. Ryan, for you to join us today to talk about your experience with folic acid and with working with different populations across the Bronx. So Dr. Ryan, all yours.
Good afternoon, everyone, and thank you, Dr. Remley, for that presentation. Well appreciated. Just like yourself, I have a couple of stories to tell, which was the reason why I became such an advocate of folic acid supplementation. Back in the mid-70s, when I was entering college, I wasn't sure if I wanted to pursue a pre-med, career. So I actually declared a major in education, and it was a special education. In that first year, I visited state institutions where I saw infants with spina bifida in their cribs, hydrocephaly. It was very disturbing. And it was seeing those images that actually made me decide I did want to go into medicine. After completing my residency and as a junior attending, coming back to New York, I encountered a patient. She was probably about 26 weeks gestation, late to prenatal care. Unfortunately, her fetal anatomy scan showed 3 neural tube defects, the largest being down in the lumbar sacral region. I referred her for consultation to pediatric neurosurgeons, pediatric neurologists. When the patient came back to me at maybe approximately 28 weeks, she was devastated to hear of the multiple surgeries that this infant would have to undergo after delivery, and still no guarantee of bladder and rectal function. And the woman, unfortunately, said, I just cannot go on with this pregnancy. New York at the time only allowed termination up to 24 weeks, and here now is a woman at 28 weeks. This woman went out to a state in the Midwest where they were offering terminations up to 30 weeks gestation, specifically for fetuses with anomalies. On her return, it was so obvious the trauma and the anguish that this poor woman went through and the depression that she went into. As a provider treating her, I was as equally anguished. And it was at that time that I said, oh, folic acid supplementation, something so simple as taking a pill or even dietary supplementation could possibly have prevented this condition. And I did not want to see another woman go through that again. On a happy note, this woman did conceive about 3 years later and delivered a healthy baby. But that has become my advocacy of folic acid supplementation. And as Dr. Remley had stated, this was a Hispanic woman. And it is true that Hispanic women do tend to have lower folate levels. And just like their dietary means, everyone's culture is different. Sometimes I can turn around and say, oh, we'll eat more of this and that, but that's just not in their diet. So you need to educate these women about foods that are fortified, that are consistent with the diet that they eat, but more specifically getting them on folic acid. And the providers here, at least our OBGYN providers here at Union Community, take pride in taking a very good reproductive planning history on these patients so that we can get them on folic acid prior to conception. And so we can hopefully avoid any bad outcomes and just see lovely, wonderful deliveries of healthy, normal babies. That's really all I have to say, is just that the importance of providers to definitely have these discussions with their patients, to let them be knowledgeable on the effects of maybe not taking folic acid, and assuring a very healthy equity for all these women. And that's all I really have to say. And I thank you very much for having me.
Great. Thank you so much, Dr. Ryan.